I'm Dr. James Fulton. I'm a board-certified allergy and immunologist. Originally, I come from California. I did my undergrad there and actually did a master's in molecular immunology. That's where my interest in immunology was picked. And from there, I went to Omaha, Creighton University for medical school, studied there, and also continued with internal medicine. And then with an interest in allergy immunology, I followed that up with a fellowship at National Jewish. Since National Jewish, I was in private practice for 3 years in Fort Collins, and I recently made the move down here to Colorado Springs, and I'm just ecstatic to be part of the group here. Yeah, so one interest of mine would be asthma. I'm always excited to work with the patients who are more of the severe type. Most patients will respond to conventional treatments, but we do find about 10% that don't respond to the typical asthma treatments that we think about with inhalers. This group, it's a really interesting time in our field of medicine because now we have 5 new medications that have come out over the years that specifically target the different pathways of inflammation that lead to asthma. I like to think of asthma as a whole spectrum of different conditions or disease types that lead to the ultimate wheeze and respiratory symptoms like shortness of breath and chest tightness. But with these new medications, they target a specific pathway of the inflammation that may be affecting the patient. And so we could really improve their control, whereas before, years ago, they didn't have these treatments available. With the ultimate goal, getting the patient feeling better and improving their quality of life. I love what I do. I feel very grateful and lucky to be a part of this field. For me, I really approach medicine as it's a shared decision-making process with the patient. And I think that starts with educating the patient, giving them all the information so that they could better understand their condition and how it affects them. And then from there, we could build off of talking about all the different treatment options and coming up with a plan that's tailored specifically for them.